friends, in this video we'll discuss about diseases of pulp, that is the pulpal pathosis. Often the patient present in the clinic with various symptoms and often land us in dilemma like what can be the diagnosis and what can be the treatment plan. So the most important thing to come with an accurate diagnosis is to listen to the patient. Then we should question to the patient, we should do questioning, then we should do examination and interpretation. Like what can be the differential diagnosis, then after doing some examinations and come up with a final diagnosis and go with the treatment plan. So in endodontic diagnosis, we have pulpal diagnosis and periapical diagnosis. And we all know pulp is a connective tissue consisting of a nerves, blood vessels, and a ground substance that contains odontoblasts and fibroblast cells. And the diseases of the pulp and the periapical tissues are very dynamic and progressive. So the symptoms will vary depending upon the stage of the disease and the patient status. Now, why we need to have a diagnosis? Why we need to have a proper diagnosis? Because to establish a proper pulpal and periapical diagnosis is to determine what clinical treatment is needed and when and where it is needed. So to avoid the unnecessary intervention and the treatment for a tooth. For a proper endodontic diagnosis, we should have the following history or the things we should take before coming to proper diagnosis. Like we should have asked the patient to proper the medical and dental history, the chief complaint of the patient. We should note ODPR, the onset of the pain, the duration, the progression, the recurrence of the pain, any medication the patient has undertaken. Then we should go for the examination, proper examination. The extraoral including the facial symmetry. We should check the offending tooth or adjacent tooth and should have a soft tissue examination, check for any sinus tract. Should do a proper periodontal probing, any deep pockets, the mobility, any caries, the restorations, whether they are defective or newly placed. We should ask whether it has been newly placed. And then go with the clinical testing. We should go for some thermal testing, the cold test, heat test, go for electric pulp testing, some periapical tests. Those include the percussion, palpation, and the tooth sleuth, that is the biting test. Biting test will help to differentially diagnose a apical periodontitis or help to find out to come to the diagnosis whether there is any fracture of a tooth. Go with the proper radiographic analysis, includes radiograph around at least 2 we should do for a tooth with different angulations, periapical radiographs, the bite wings, the CBGTs, and additional tests can also be done. So why these such all the things are very important to come in endodontic diagnosis? Because the pulp, it is encased inside the hard tissue. We are not able to see directly. So it is the through amalgamation of your objective and subjective findings, the clinical diagnosis through examinations, we can come to the proper diagnosis and further treatment plan. So up till now, what till 2007, when this terminologies have been given by American Association of Endodontics, till then we have all various classifications. We have Grossman classifications. They all are based on the histological features of a pulp. But when the patient comes to the clinic, he gives some history. Depending upon the history, AE has categorized the pulp into various categories. It can be a normal pulp. And then the inflammation of the pulp, it can be categorized as reversible and irreversible depending upon the symptoms and examination, various examination. Then there is a condition that is necrosis, that is the death of the pulp. Then 2 terms have been added, that is previously initiated therapy and previously treated tooth. So before discussing these reversible and irreversible in detail, we should know what is a normal pulp. The pulp that is symptom free, that doesn't have any symptoms. And on testing, give a normal response. When I am doing some thermal testing at the cold and heat test, it gives a momentarily pain and persists for 1 or 2 seconds and goes on its own. That is a condition for a normal pulp. And now, what is the pulp necrosis? It is the death of the pulp. When we test a tooth, the patient doesn't give any symptoms. On testing, pulp shows no symptoms. It means it has been necrosed. There is a death of the pulp. And when we do an EPT, it doesn't show any response. Or in cases of like testing, it either give a very delayed response. It means it has gone toward necrosis. Now, what does the term mean? Previously initiated therapy. It's a tooth that has been root canal treatment with partial endodontic therapy. Partial endodontic therapy means either pulpotomy and pulpectomy. And previously treated tooth in this category will place all the tooth that has been endodontically treated and obturated or filled with the material except intracanal medicament. The tooth that has been restored with intracanal medicament cannot be placed in a category of previously treated tooth. Now come with the term reversible pulpitis. Means it is an inflammation of the pulp that we can reverse. So generally in clinical conditions, what are the situations where the patient presents with such condition? Either it is a patient after recent restoration, after a recent some the crown or some after composite restoration, patient do have such symptoms. After root scaling, after a patient is having a traumatic brushing technique, the tooth that has incipient caries, or after a trauma when a tooth has small infractions in the crown, the patient do have a condition of reversible pulpitis, or the patient who is undergoing vital bleaching, such tooth may have been placed in a condition of reversible pulpitis. Now what actually the symptoms is there in reversible pulpitis? Patient will give a history of like have a very sharp pain after some noxious stimuli. What can be the noxious stimuli? It is either cold or sweet or some cold air. Patient have a sharp pain for a few seconds, like momentarily pain, and it goes up when the stimulus is removed on its own. Pain never is spontaneous. It is always followed by some stimuli, and the pulp here it is mild to moderately inflamed, and it does not continue when the cause has been removed. As soon as the stimulus has been removed, it goes on its own. And when we diagnose such tooth, they react normal to percussion and palpation and mobility testing. And periapical, it means the periapical tissue is normal, and radiographic examination shows no pedial widening or any such conditions. It has to be differentially diagnosed with irreversible pulpitis because their pain lasts for several minutes. So what is the treatment for it is prevention. So we should know if there is a reversible pulpitis, so the removal of stimuli is important. And how we can prevent such condition? If there is some root recession, we can do desensitization of the neck. We can place a desensitizer on that, and the patient won't have any symptoms because we are blocking the dentinal tubules with the desensitizers, and patient will no longer will have a symptoms of sharp pain to either cold or sweet. But it has to be differentiated from the term hypersensitivity, because in case of hypersensitivity, patient have a sharp pain, but the hypersensitive tooth it's not an inflammatory condition. It is an hyperactive tooth where due to the movement of the dentinal fluid, patient have pain. But the condition reversible pulpitis is inflammatory condition and the pulp is inflamed. So such tooth should be tested time to time for the vitality, and if there is a severe pulpal necrosis with time, if the patient doesn't give any symptoms on vitality testing, it means the pulp has gone towards necrosis. So for that, depending upon that, our treatment plan will change. Now, what is irreversible pulpitis? So based on our subjective and objective finding, when the inflammation of the pulp cannot be reversed, such condition is called as irreversible pulpitis. This irreversible pulpitis has various presentation. It can be symptomatic or asymptomatic. When the patient have symptoms, what symptoms the patient have? In such patient have a sharp pain in earlier stages. It may be chronic irreversible pulpitis. In case of chronic, patient has a dull, boring, gnawing pain. But generally, in case of acute symptomatic pulpitis, acute or symptomatic, the one and same, such patient will have a sharp pain on thermal stimuli. The pain is lingering. Lingering, what is the main meaning of lingering? Means a tooth has 30-second or longer pain on removal of stimuli. Even after removal of stimuli, pain persists. Then such condition is irreversible. And pain can be, generally it is spontaneous, unprovoked pain. Pain is generally referred. When the posterior tooth are involved, patient generally given history like I have a radiating pain to my ear, temple region or adjacent tooth. Or it may occur like patient will say like when I lie down or when I bend, I have a severe pain. So the pain get accentuated by change in posture. Why such happens? Because the intrapulpal pressure increase. Because here the pulp has been inflamed, because pulp can contain blood vessels. So there is an inflammation, there is a proliferation of the blood vessels, and when the blood vessels proliferate, they don't have any space because they are encased inside the hard tissue. They have no space to expand, so they have a severe pain. And generally, in case of symptomatic or acute irreversible pulpitis, the over-the-counter analgesic drugs are not at all effective. And such tooth are very difficult to diagnose because the pulp, any stimuli we give to the pulp, it will give a response of pain. And pulp doesn't contain any proprioceptive fibers. When it doesn't have proprio, we cannot find the offending tooth. Like this tooth is affected. So until this infection it goes to the PDL, until it doesn't show the positive test on periodontal examination, we cannot come to the proper diagnosis. So how we can find that offending tooth depending upon the our dental history and thermal testing. They are the primary tools for assessing the pulpal status of the such teeth. Sometimes the patient, when we see a radiograph, we can correctly see there is a deep caries, and but the patient doesn't have any symptoms. On examination, we can see the caries. When we are probing, patient doesn't have any symptoms until we do a deep probing. But on radiographic examination, we can generally see, like whenever I'm going to excavate such caries, I'm going to lend to exposure of the pulp. So such will be placed in a condition of irreversible pulpitis, but the patient is asymptomatic. And diagnosis, it will be based on inspection, deep cavity extending to the pulp, probing into the area, may not have, but when we do deep probing, pain. And on radiographic will show exposure of the pulp. There is different presentation for irreversible pulpitis. This is a condition of hyperactive pulpagia, hyperactive pulpitis, or pulp polyp. Pulp polyp is a condition when the patient have like the proliferation of the pulp, or we can say growth of the pulp from the pulp chamber into the occlusal surface that is covered with an epithelium. It generally happens in a young patient, generally comes with such condition, and it can occur in a young or either young patients, generally occur in young patients, either in permanent or primary dentition. So the treatment is root canal treatment for that. Or the irreversible pulpitis can have a condition of internal resorption. Internal resorption occur when a pulp has dentinoclastic activity. Due to the clastic activity, the dentine it has been resorbed and will give us such a presentation of large balloon rounding of round radiolucency. And such tooth has to be root canal treated, and we have in the certain protocol has to be followed during irrigation, and during obturation warm vertical condensation has to be done. This is a tooth. By seeing this tooth, we have a resorption, periapical radiolucency, and on such condition we'll classify in chronic. So what actually is acute and chronic? Acute and chronic refer to the timing. It is not refer to intensity of the pain. It's the timing. When a patient has pain, which is he has lived with the pain for months and years, we categorize that condition into the chronic. And present with such condition, and present with such conditions like this, root resorption, and on TOP may be positive, and generally it is suppressed with analgesic. Pain is not severe. And radiographic examination, we can see the resorption or condensing osteitis, at times radiopacity under the root. So such condition is chronic. But when the patient have a severe pain from few weeks or days, then it is acute condition. Now there are other certain terms related to pulpal pathosis, that is calcific metamorphosis. Now what actually calcific metamorphosis is? In response to trauma, there is a deposition of hard tissue within the canal space. We cannot appreciate the radiolucent line, that is the pulp canal. When we cannot appreciate, because whole the tissue, it has been deposited with hard tissue. All the pulp chamber, it is there is a deposition of hard tissue. So we have to assess the condition, whether to initiate the root canal or not. Generally, at times they have a very narrow canal. Then we have to go for root canal treatment for such. At times the calcification, it may be complete calcification, that we call the term calcific metamorphosis. At times we have a dystrophic calcification, like denticles will form, pulp stones will form, and it is a result of aging pulp. It can be perivascular or perineural. So they may obliterate during cleaning and shaping. So we have to remove the pulp stones and we have to go ahead. Now there is a term aerodontalgia. What actually aerodontalgia means? It is a condition of irreversible pulpitis that was sealed, and the patient, it will elicit pain when the pressure is decreased. Pressure decrease, like when a patient go on high mountains or during the flight, when the it descend, patient experience a certain severe pain. Such condition of irreversible pulpitis has been termed as aerodontalgia. So if we see such a radiograph, if we solve a problem and the patient in such condition say like I have given this crown around a month before and he has now sensitivity to heat and cold, and on periodontal examination doesn't have any tender tooth, so what it can be on heat and cold, so it is generally irreversible pulpitis condition and has been pain for few weeks, so it is an acute irreversible pulpitis, so we have to remove such that's this crown and go for root canal treatment. And generally for if we do testing, thermal testing or electrical testing, the cases in which there is a reversible pulpitis, it is hypersensitive, hyper-responsive tooth, and compared to the normal will give an early response. In cases of irreversible pulpitis, we will show a delayed response compared to the baseline test. So these are the things that we should keep in mind whenever the patient comes to the clinic, and depending upon your clinical diagnosis, based on your knowledge, based on their history, the examination, the radiographic interpretation, we should come up with the proper diagnosis and go with a treatment plan. Thank you.